The truth behind CBC tests, how they can save lives and improve well-being. Introduction to CBC tests. CBC tests, also known as complete blood count tests, are a fundamental component of modern healthcare. These tests provide valuable insights into a person's overall health and well-being by analyzing various components of their blood. With the ability to detect a wide range of health conditions, CBC tests play a crucial role in early detection, diagnosis, and monitoring of diseases. This article aims to explore the truth behind CBC tests, shedding light on their significance, the science behind them, common health conditions they can detect, their benefits and limitations, interpretation of test results, integration into healthcare routines, and the future advancements in CBC testing technology. Understanding the power of CBC tests can not only save lives but also significantly improve well-being. Introduction to CBC tests. What are CBC tests? CBC tests, short for complete blood count tests, are a basic blood test that provides valuable information about a person's overall health. It measures various components of the blood, such as red blood cells, white blood cells, and platelets. The significance of CBC tests in healthcare. CBC tests play a crucial role in healthcare because they help doctors assess a person's general well-being, detect potential health conditions, and monitor ongoing treatments. By analyzing the levels and characteristics of blood components, doctors can make informed decisions about medical interventions and provide appropriate care for their patients. Understanding the importance of CBC tests. Early detection of health conditions. One of the key benefits of CBC tests is their ability to detect health conditions at an early stage. Abnormal levels of blood components, such as low red blood cell count or elevated white blood cell count, can serve as warning signs for various disorders. Identifying these issues early on allows for timely intervention and treatment, potentially saving lives in the process. Monitoring overall health and well-being. CBC tests are not only useful for diagnosing specific conditions but also for monitoring overall health and well-being. By regularly checking a person's blood counts, doctors can track any changes over time, ensuring that their patients remain healthy or identifying any underlying issues that need attention. Identifying underlying causes of symptoms. Sometimes, people experience symptoms without knowing the exact cause. CBC tests can provide valuable insights by highlighting any abnormalities in blood counts that may be contributing to these symptoms. This information helps doctors narrow down potential diagnoses and develop appropriate treatment plans. The science behind CBC tests. Components of a complete count. A complete blood count typically includes measurements of red blood cells, white blood cells, hemoglobin, hematocrit, platelets, and other related parameters. Each of these components provides valuable information about a person's blood health and can indicate potential issues. How CBC tests are conducted. CBC tests are usually done by drawing a small sample of blood from a vein. The blood sample is then analyzed using automated machines that measure the various blood components accurately and efficiently. The results are typically available within a short period, enabling swift decision-making by healthcare professionals. Understanding reference ranges and normal values. CBC test results are compared to reference ranges or normal values to assess whether the blood counts are within a healthy range. These ranges may vary depending on factors such as age, sex, and overall health. If any component falls outside the expected range, it could indicate an underlying health condition that requires further investigation. Common health conditions detected through CBC tests. Anemia and related disorders. CBC tests are instrumental in diagnosing anemia, which is a condition characterized by low levels of red blood cells or hemoglobin. Additionally, they can help identify other related disorders, such as vitamin deficiencies or chronic illnesses, that may be causing anemia. Infections and inflammatory conditions. Elevated white blood cell counts in a CBC test often signal the presence of infections or inflammatory conditions. By detecting these abnormal levels, doctors can initiate appropriate treatments to address the underlying causes and manage the associated symptoms. Leukemia and other hematological malignancies. CBC tests can be instrumental in identifying hematological malignancies such as leukemia, lymphoma, or myeloma. Abnormal white blood cell counts or other irregularities in the blood sample can prompt further investigation, leading to early diagnosis and better management of these conditions. In conclusion, CBC tests are essential tools in the medical world that provide valuable insights into a person's overall health and help detect various health conditions. By understanding the significance, science, and common conditions identified through CBC tests, individuals can take control of their well-being and empower themselves for a healthier future. So, don't be afraid of a little blood work, it just might save your life and improve your well-being. Benefits and limitations of CBC tests. Advantages of CBC tests. CBC tests, or complete blood count tests, are a valuable tool in healthcare that provide a wealth of information about a person's overall health. These tests can help detect and diagnose a wide range of conditions, including infections, anemia, and certain types of cancer. With just a single blood sample, CBC tests provide information about various components of blood, such as red blood cells, white blood cells, and platelets, which can help identify potential abnormalities and guide further investigations or treatment plans. CBC tests are relatively quick, non-invasive, and cost-effective, making them accessible to a wide range of patients. Limitations and potential drawbacks. While CBC tests offer many benefits, it's important to acknowledge their limitations. CBC tests provide general information about blood components but do not provide a specific diagnosis for a particular condition. Further tests and investigations are often required to confirm or narrow down potential health concerns. Additionally, CBC tests do not determine the underlying cause of abnormalities, they simply indicate that something may be amiss. False positives and false negatives are also possible, meaning that abnormalities may be missed or flagged when there is no significant health issue present. Therefore, CBC tests should always be interpreted in conjunction with other clinical information and consultation with healthcare professionals. Considerations for accurate results. To ensure accurate results from CBC tests, certain considerations should be taken into account. It is essential to follow any preparatory instructions provided, such as fasting requirements or avoiding certain medications that may interfere with blood parameters. Timing can also be crucial, as some blood components may vary throughout the day. Moreover, external factors like stress or recent strenuous activity can temporarily affect CBC results. Therefore, it's important to discuss any influencing factors with your healthcare provider to ensure the most accurate interpretation of your test results. Interpreting CBC test results. Understanding individual CBC parameters. When you receive your CBC test results, it can be overwhelming to decipher the numbers and abbreviations. Understanding the individual parameters will help make sense of the information. Key components of CBC include red blood cell count, white blood cell count, hemoglobin level, hematocrit, and platelet count. Each of these parameters provides unique insights into different aspects of your blood health. Familiarizing yourself with their normal ranges and what deviations from those ranges may indicate can empower you to have more informed discussions with your healthcare provider. Recognizing abnormal CBC patterns. Sometimes, CBC test results may show abnormal patterns that can be indicative of specific health concerns. For example, a low red blood cell count and hemoglobin level may suggest anemia, while a high white blood cell count may indicate an ongoing infection. Identifying these patterns can help guide further investigations and contribute to more accurate diagnoses. However, it's important to remember that an abnormal CBC pattern does not provide a definitive diagnosis but rather serves as a starting point for further evaluation. Consulting with healthcare professionals for interpretation. Interpreting CBC test results is a complex task that requires expertise and consideration of individual context. While it can be tempting to consult Dr. Google for an instant diagnosis, it's always best to consult with healthcare professionals. They have the knowledge and experience to interpret test results in the context of your overall health and medical history. Your healthcare provider can explain what the results mean for you specifically and guide you through any necessary follow-up steps or treatment plans. Remember, they are there to help you navigate the intricacies of your health, so don't hesitate to ask questions or seek clarification. Integrating CBC tests into healthcare routines. Recommended frequency of CBC testing. The frequency of CBC testing varies depending on individual health needs and medical history. For individuals with no specific health concerns, periodic CBC tests may be part of routine checkups every few years. However, for those managing chronic conditions or undergoing certain treatments, more frequent CBC testing may be necessary. It's important to follow the recommendations of your healthcare provider to ensure appropriate monitoring of your health. Incorporating CBC tests in preventive care. CBC tests play a crucial role in preventive care by detecting potential health issues early on. Regularly monitoring blood parameters through CBC tests can help identify changes that may indicate the presence of underlying health conditions. Taking a proactive approach to your health allows for timely intervention and management, leading to better outcomes in the long run. Collaboration between patients and healthcare providers. Integrating CBC tests into healthcare routines is a collaborative effort between patients and healthcare providers. By being proactive in scheduling and attending tests, maintaining open communication, and actively participating in discussions about test results, patients can actively contribute to their own well-being. Working together with healthcare providers ensures that CBC tests are used effectively and that the information they provide is utilized to improve health outcomes. Future advancements in CBC testing technology. Emerging trends in CBC test innovation. As technology continues to advance, so does the field of CBC testing. Newer innovations and techniques are being developed to enhance the accuracy, efficiency, and scope of CBC tests. For instance, advancements in automation and digitalization have streamlined the process, allowing for quicker turnaround times and improved precision. Additionally, researchers are exploring the potential use of artificial intelligence and machine learning algorithms to aid in interpreting CBC test results and identifying patterns that may be difficult to detect with the naked eye. Potential impact on healthcare outcomes. The future advancements in CBC testing technology hold the potential to revolutionize healthcare outcomes. With improved accuracy and efficiency, healthcare providers can detect diseases earlier, leading to better treatment outcomes and improved patient well-being. Additionally, the integration of advanced technology into CBC testing may contribute to cost reduction, accessibility, and global health initiatives, making quality healthcare more accessible to all. Challenges and opportunities for future development. While the future of CBC testing is promising, there are still challenges to overcome. Standardization of testing methods, interpretation guidelines, and result reporting across different laboratories is crucial for consistency and meaningful comparisons. Moreover, ensuring the ethical use of emerging technologies and maintaining patient privacy and data security are essential considerations. By addressing these challenges and seizing the opportunities presented by technological advancements, CBC testing can continue to evolve to meet the ever-changing healthcare needs of individuals and communities worldwide. In conclusion, CBC tests are an invaluable tool in healthcare that can save lives and improve overall well-being. Through their ability to detect various health conditions, CBC tests provide early intervention opportunities and help guide treatment plans. While they have their limitations, the benefits of CBC tests far outweigh any drawbacks. By understanding and interpreting CBC test results, individuals can take proactive steps towards maintaining their health. As advancements in technology continue to enhance CBC testing, the future holds promising possibilities for even more accurate and comprehensive analysis. Embracing the truth behind CBC tests empowers individuals to prioritize their health, leading to a healthier and happier life.